Welcome to Lynch's Pharmacy Film Studio. Today I'm going to talk about amoxicillin. So amoxicillin is a penicillin antibiotic. You make sure you tell your doctor if you are allergic to penicillin. So amoxicillin is a type of penicillin, and do not take it if you're allergic to it. So why take amoxicillin? Amoxicillin is given to treat bacterial infections. It is mainly prescribed for sinus and chest infections, urine infections, ear infections, and some dental infections. It may also be prescribed it to prevent an infection from occurring if you are at particular risk of getting an infection. So as I said, amoxicillin is a penicillin antibiotic which treats infections by killing the germs responsible for the infection. Amoxicillin is sometimes used to get rid of Helicobacter pylori. This is an infection found in people with stomach ulcers. So you take amoxicillin exactly as directed by your doctor. It is usually taken 3 times a day, every 8 hours. Your dose will be different to this if you're being treated with sachets of amoxicillin powder, which are prescribed by dentists normally, or if you're being treated for stomach ulcers. Your doctor or pharmacist will tell you how you should take the medication, and this information will be printed on the label of the pack to remind you. So it is important that you space out your doses evenly during the day. If you've been given the liquid medicine for children, shake the bottle well before use and read the directions carefully to make sure you measure out the correct amount of medicine. You can take amoxicillin either with or without food. The capsule should be swallowed whole with a drink of water. If you have been prescribed amoxicillin powder sachets, stir the powder from the sachet into about 20 ml of water. Drink the solution as soon as possible after mixing it, so don't leave it sit on the counter. If you forget to take a dose at the correct time, take one as soon as you remember. Try to take the correct number of doses each day, leaving at least 4 hours between doses. Do not take 2 doses at the same time to make up for a forgotten dose earlier in the day. So getting the most from your treatment. If you or your child have been prescribed the oral liquid medicine, you may find that it causes some staining of the teeth. Brushing the teeth regularly helps to prevent this. Any staining usually disappears soon after the course of antibiotics is finished. So even if you feel your infection has cleared up, keep taking the antibiotic until the course is finished, unless a doctor tells you otherwise. This is to prevent the infection from coming back. Antibiotics are usually prescribed in short courses of treatment. Your doctor will tell you how long your course of treatment will last. This is not usually for longer than 14 days. If you still feel unwell after finishing the course, go back to see your doctor. Some people develop redness and itching in the mouth or vagina from thrush after taking a course of antibiotics. If this happens to you, speak with your doctor or pharmacist for advice. So if you're taking the contraceptive pill at the same time as this antibiotic, the effectiveness of the pill can be reduced, especially if you have a bout of being sick, vomiting, or diarrhea, which lasts for more than 24 hours. If this should happen, ask your doctor or pharmacist for advice about what additional contraceptive precautions to use over the following few days. There is no need to use additional precautions for any bouts of sickness or diarrhea which last for less than 24 hours. So amoxicillin can stop the oral typhoid vaccine from working. If you are due to have any vaccinations, make sure the person treating you knows that you are taking this antibiotic. So the main side effects of amoxicillin is feeling or being sick, diarrhea, thrush, and a skin rash. It shouldn't be taken in pregnancy unless recommended by a doctor, and traces have been found in breast milk, so not while you're breastfeeding, unless again recommended by the doctor. It interactions with a couple of medicines like warfarin and tetracyclines, so tell your pharmacist or doctor what medicines you're currently taking. And it's caution in use with glandular fever and other illnesses. Again, talk to your doctor before you start taking this medicine. So if you develop an itchy rash, swollen face or mouth, or have difficulty breathing, these may be signs that you are allergic to the penicillin antibiotic. Do not take any more amoxicillin, and speak with your doctor or go to your local accident and emergency department immediately. So to store the medicine, you keep the medicine in its container it came in, tightly closed and out of reach of children. You store the capsules and tablets at room temperature and away from excess heat and moisture, so not in a bathroom. You return any unused medicine or out-of-date medicine that you no longer need to the pharmacy. The liquid medicine for children should be kept preferably in a fridge, but it may be stored at room temperature. When you're finished the medicine, if there's any left, bring it back to the pharmacy. We can dispose of it for you. If you have any questions, you can contact me through the live pharmacist on my website, or ring or call into the pharmacy. Thank you.